Welcome to the Tom Matt Show. You are walking through the front door of the refirement zone. And now, your host, Tom Matt.
Welcome back, everybody. Welcome back to the Tom Matt Show. Thank you, Sandy, for bringing us in. Love hearing her voice on the top of our show. It's awesome. She's the best. Keeps things rolling for us. Last week kind of fits in with today's show a little bit. Giannis Griggin Jr. was with us. Getting Healthier, Advancements in Patient Care. Pain Management is what we called that one because it related to my knee replacement and the nice ice machine that I used for my second knee and how effective that was. And so it's just, there are options. There's options, everybody. And today we're going to talk about more options because I got a trio happening here. Dr. Matt McCord is going to be with us. Mike Vasquez will be with us, and Doug Geinzer is going to be with us, and they are with us. We're going to call this one Opioid-Free America, the 5 W's. I hope you remember the 5 W's, everybody. Who, what, where, and why. We'll talk about this Opioid-Free America thing. I'm going to do a quick intro for the guys because we have, 3 guests today. So Dr. Matt McCord, we met as he was doing my injection for my back for my first knee replacement. So Dr. Matt McCord is a pioneering physician, veteran, and national leader in opioid-free surgical care and prevention, former U.S. Air Force Medical Corps major. I did not know that. Congratulations on that, and thank you for your service. And he founded Opioid-Free America to combat opioid dependence. He is an anesthesiologist. He did my anesthesia for that first knee. As I said, Doug Geinzer is the founder and president of the president of the High Performance Portfolio of Companies. So he's just a smart guy who knows how to get things done, known for building strong partnerships with industry. All these guys are great guys. I mean, it's just like, let's just talk to these cats here. Over 20 years experience in the healthcare industry. These guys know what's going on. And then there's Mike Vasquez. These guys are all the brains behind the product here, or behind the services, behind the website, behind the whole educational model. Mike Vasquez's own mother was a victim of the opioid crisis in 1961. I'm so sorry to hear that, and struggled with addiction for the rest of her life. That is just awful. Mike started his business that helped thousands of opioid addicted patients successfully detox. He's also done many things. I'll let him talk about that. First, let's go to Dr. Matt McCord. Each of you, go ahead and take your intro, guys. You want to do Mike first? Matt, you're kind of running things for me. So how do you want to flow with this? You want to do Mike first?
Thanks for having us on. Yeah, I want to start with Mike and very soon, but I want to talk about really Opioid-Free America for a brief moment and what we're all about. We believe that every generation deserves a healthier America than the one before it, and we're all about that. We're helping America get healthier, and we're doing that with data. So I've got a really compelling story, and we all do. And I'd like to start with Mike and his story on how he created this excellent technology. So go ahead, Mike.
It actually started with me as Tom mentioned. I was 14, walked in from school and found my mother on the floor with a needle in her arm. And that kind of just sort of stuck with me. It's not like I was driven from that moment, but it did kind of guide my independence. As I got into the corporate world after college, I had an opportunity to be part of a project that wrote the first hospital information system with integrated AI. It went public. I took it public on NASDAQ, sold to 3M Healthcare. And then during that same period, had family members become involved with opioids, and their best friend died. So we thought, we've been blessed with time, resources. Let's see if we can jump in and help at a small scale. I live in Des Moines, Iowa. I hadn't learned, I still probably as of today haven't learned how to do small scale. So fast forward 12 years, we built one of the largest opioid treatment programs in the country. I had 300 patients in residence every day. 80% of our patients came from Florida, California, and Texas, so they had lots of choices, and Des Moines, Iowa is not exactly beach destination country. So it was because of the unique way we'd broken down the brain chemistry as you deal with opioid dependency and addiction, and were able to survive that. got identified by a company, a venture capital roll-up in 2019 that I sold the company to, and found myself sitting there with hundreds of thousands after 12 years of opioid data points and patient charts, and then a passion, obviously, for healthcare IT. So therein lied the challenge. But my challenge was I didn't want to try to treat somebody better. I didn't want to build a body shop to rebuild the wreck. I wanted to figure out how to not let the wreck happen. And so at that point, I challenged the team and I said, how can we prevent these patients from progressing to addiction, but still have access to viable pain management? Because that's a reality of the world. You're going to have injuries, you're going to have surgeries. You still need to manage the pain until you get back to normal daily living, but not let it progress past that. So that was a challenge we threw out to the team. Took us a year. We had to invent some software. Obviously, is with the timing, you can imagine COVID hit. We just went heads down and started developing. Got a good beta partner to test out our theories, and proved out that what we were doing could be effective. There was an ability to do this, and I'll talk more about how we developed it and the patterns. Results are, though, on average, we can reduce opioid unnecessary prescribing 75%. We have a 10,000 member teachers union in Central Florida. They've had the product 3 years, reduced unnecessary opioid prescribing 75%, and saved $1.3 million in hard dollars along the way. But the key takeaway is we've been there 3 years and the teachers still don't know we're installed. We're completely transparent to the patient. They still don't know who we are. So I'll drill down as we discuss, but I'll give you kind of a 50,000 foot view of kind of where I'm coming from.
Perfect. Doug, can you give us a couple minute, this is your life, kind of who you are and why you're involved with this and what your passion is, please?
Sure. I think the common thread here is Matt McCord, Dr. McCord. So I myself work in the self-funded health plan space, really at the intersection of self-funded health plans and creative solutions that help them with their problems. I've been an entrepreneur my entire career, born and raised in Pittsburgh, Pennsylvania, moved to the desert here in Las Vegas, Nevada about 35 years ago, built and sold several businesses along the way, got involved in healthcare thinking I could make a big difference. And there's just a lot of misaligned incentives. When I was talking to Dr. McCord and he told me about the hard work that he was doing in the opioid crisis, I immediately raised my hand and said, how can I help? This is a national issue. It's a national problem. I myself am a veteran as well. I've lost too damn many friends, family, fraternity brothers, military brothers to a senseless crisis, something that should not have happened in the first place and something that we could solve. It started out with opioid-free surgery, which obviously you're very familiar with. And then as Dr. McCord and I were having conversations, we started asking the question, how do we get ahead of this curve? How do we keep going upstream? And that's when we found Mike Vasquez and heard what Mike was doing. We said, how do we put fuel on the fire that you've already started, really make this a national initiative? My network is made up of benefit advisors, TPA, stop loss carriers, everybody that's in that mix in the self-funded health benefit space. And so my job is really to put together the puzzle of all these different pieces so we can eradicate or get rid of the opioid overprescribing. The goal is to do that by the year 2030.
Beautiful. Okay. Matt, I'm going to hold you for a second because we're going to come up on break here. Let me reset this thing, everybody, so we know where we're at. This is a very, very important radio program, podcast. I'm so grateful to my guests today for taking the time. These guys are very, very busy, very, very, very busy professionals, and they're very passionate about what they're doing. Dr. Matt McCord's our guest, Mike Vasquez and Doug Geinzer are with us, calling this one Opioid-Free America, the 5 Ws. I have some extensive notes from Dr. Matt McCord. Dr. Matt McCord was my anesthesiologist for my first knee, as I said a little bit earlier. It was kind of funny how we met, and but I'm always looking for good guests, and then we immediately clicked. And this is such an important topic, so important that we have to have these guys on regularly just to talk about this, because if we're going to have a society and a culture in the United States that is sufficiently growing and healthy, we need to have men like this helping us. Go to the pros. Be proactive, preventative. Love this stuff. Fuel on the fire. I love it. Opioid-free America, the 5 W's, with the 3 big hitters, Matt McCord, Dr. Matt McCord, Mike Vasquez, and Doug Geinzer. You're listening to The Tom Matt Show.
Welcome to The Tom Matt Show.
Welcome back, everybody, to The Tom Matt Show. This is a very, very important radio program podcast. Dr. Matt McCord, Mike Vasquez, Doug Geinzer's with us. Opioid-free America, the 5 W's, who, what, where, and why. Before we get restarted with the fellas, got to talk about our sponsor, Brock Fletcher, and the selling team of Keller Williams Realty, where trust is their middle name. You know, I've said the story 1,000 times. Brock Fletcher's helped us several times with home selling, home buying. We helped us sell Big House Hold, our forever home that we built from dirt and never thought we'd ever get rid of, and made that conversation with Sandy, which that went well, thanks to Brock. And then we bought Little House Lansing. We're recording this episode right now. I'd like you guys to give Brock a call. Here's his office number, 517-853-6408 or 517-303-3262. That's his cell phone number. Go online to kwsellingteam.com, kwsellingteam.com. You can go to our website, tommattshow.com, and at the bottom of the homepage, there are banners for our friends and sponsors. Click on through. As a matter of fact, I was just thinking about this. I'm going to get Dr. Matt McCord to get me his banner so we can put a click through on our homepage for that, just so you guys can easily find Opioid-free America and get more information from our guests today, because this is such an important topic, and I guarantee our guest will be back. I want to also say thank you to Joan Wright and hello to Joan for being a customer of Brock's and the whole team over there. Most agents, as I say all the time, you guys, most agents in the real estate game start spending marketing money after they get your listing, not Brock. Not Brock. Brock is an investor. He's a good guy. He's a great guy. He's a good friend, brother from another mother, like my 3 brothers from another mother on the show today. And he's just the team is the best. kwsellingteam.com. Again, here's the phone number, 517-303-3262. That is Brock's cell phone. Use it. Text him. Leave him a voicemail. He's happy to have you call him. All right, back to the show. I was so excited to get this show going here. And as I started reading the documentation from Dr. McCord, Dr. Matt McCord, I was just blown away. I mean, I've known we've had an opioid problem in the country because, you see the marketing out there, but I'm so happy that we have these 3 professionals who really know this. Matt, let's do a little bit of your background, and you didn't get a chance to do your bio yet, but let's do a little bit of your background, and then let's set this whole thing up where we're going. We've got a little bit of a start with Doug and Mike Vasquez and Doug Geinzer. But go ahead. It's your turn. Go ahead. Share with everybody a little bit about yourself, and then where are we going today?
Yeah. Thanks, Tom. Yeah, my story with opioids really started. I was busy as an anesthesiologist at a very busy group in Ann Arbor, Michigan, at one of the largest facilities within actually Trinity Health, right across town from the university, and was busy with that practice. And I got approached through a friend with some UAW folks that were wanting to speak to me about their opioid problem. And and this was about 7 years ago. And I said, "What do you mean opioid problem?" And they shared that a significant percentage of their workforce was on opioids on the line. I'm not able to say what percentage, but it was very significant. And I couldn't believe it. I'm like, "What are you talking about?" And what was really compelling with their story is they had all their data. They had all their claims data, and they could show me exactly what they were talking about. And at the same time, one of their vice presidents, regional vice presidents, so I might be getting the title wrong, but one of the leaders in the UAW, their son or daughter overdosed from opioids right near the same time and passed, unfortunately. And I recall that, my cousin had passed from opioids, and and he was about 38. And I thought, well, yeah, we've got to get ahead of this. And since that point, I worked with the UAW on legislation here in the state of Michigan called the Non-Opioid Directive. I testified alongside them in Lansing on the Non-Opioid Directive. And it was refreshing to see that it was getting into the politics of of healthcare inside Lansing, that this was a very bipartisan problem. Everybody agreed. Everybody wanted to help solve it. And that was really refreshing. And it continues today.
Was that actually true? I mean, was there a bipartisan feel for that? Did you really feel that that was true? Or
Oh, yeah.
Okay, good.
Oh, yeah, most definitely.
Okay.
Yeah. So, and then I also, as an acute pain physician in practice, I designed opioid-free surgical programs to test my theory that, hey, we could actually do this without opioids. And we designed a opioid-free joint replacement program. You're replacing knees and hips and not using opioids. That's probably one of the most challenging clinical applications of an opioid-free program that you can imagine. And it went very, very well. And so that's kind of how I started down this path with Opioid-Free America.
Was just quite quick question? I mean, just self-serving, and I'm not because I'm selfish. But was my surgery opioid-free? I don't even know.
Yeah, not entirely, but we did use a regional block, which helped help your body reset on its pain perception.
Okay,
so that helped things a bit.
Okay. Because just where are we going now? We're going to go with, you want to go with, Mike, you've talked a lot. Doug, you want to jump in and talk about your why a little bit more and explain where you're at? We got about 2 minutes to go before we finish this segment. Please, would you take your time and explain more of your compelling why?
So early on, I talked a little bit about I've lost too many friends, family, fraternity brothers, military brothers. I'll just start with one story. So I hail from Western Pennsylvania, went to college out there in a little school called Indiana University of Pennsylvania, was part of a fraternity. Once a year, a gang of us get together and we float a river and we paddle. We call it paddling the canoes, but over the years, there's probably been 40, 50, 60 of us collectively that have gone on this trip. We've lost 4 of our fraternity brothers over the last decade. And that's just too many people. And then the same thing is true with my military friends. They come back from Afghanistan. They're a little bit rattled. The VA has not been so kind to them. I've got one of my little brother in the fraternity that we do wellness checks on him every single Friday. This doesn't have to happen. That's my why. I was like, how do we stop this from happening? How do we get this problem resolved where we're no longer building more addiction treatment centers, putting more Narcan boxes out on the street? How about we just turn off the spigot at the very top and eliminate the problem to begin with? And that's my why.
Doug, that was really good. And I'm so sorry to hear about some of there are so many stories, you guys, and everything is, and I've read some of Dr. McCord's articles about, they're burying the headline with fentanyl. They're burying the problem with fentanyl, I guess you could say. We got to get a handle on this stuff. And what we do with the radio program here is entertain and educate. Today is a lot of education, because having me personally going through this knee replacement thing, I've become very, very aware of pain management. Let me tell you, having 2 knee replaced in less than 3 months is challenging. And so it's like, okay, let's talk about this stuff, because I'm feeling really, really good. And I'll tell you, I took 1 oxy at the hospital the second time, and I felt so terrible. It's like, that stuff is, I didn't care if I had pain, because I felt so, and I could swear to heaven right now, but I won't. It was not good. It was not good. Opioid-Free America, the 5 W's with Dr. Matt McCord, Mike Vasquez, and Doug Geinzer. This is the Tom Matt Show.
Thank you again to Brock Fletcher, real estate agent at the selling team with Keller Williams Realty. For more information on services provided by Brock, please call his personal cell phone at 517-303-3262 or by emailing Brock at kwsellingteam.com. This is the Tom Matt Show.
Welcome to the Tom Matt Show.
Welcome back, everybody. Welcome back to the Tom Matt Show. Thank you so much for joining us this week. However you're joining us on radio, on the podcast, on the stream, however, whatever. Remember, we're carried on WKR at the university, at Michigan State University, on Sundays at 5 p.m. Great time slot. And you can always get the simulcast with those guys as well. We're carried on the Michigan Talk Network thanks to Steve and Ivy Gruber, and we appreciate their love and support so much. And locally, we're on WVFN now. They just moved us over to WVFN, so that's excellent, and we're just happy to be on. If you miss any portion of the radio program, please go to the podcast. I like to do the testimonials for Brock, because Brock has helped us so much. And this segment is all about testimonials. I love doing positivity. This one's from Lorelei from Portland, Michigan. And remember, Brock Fletcher, selling team of Keller Williams Realty, where trust is their middle name. Lorelei used them. You provided the very best service in bold type. And I've never had an agent like you work so hard to get the home of our dreams. Thanks so much. That happened twice for us. Okay. That happened twice for us with Brock. He sold Big Household, as I said before, and I've said many times. And then Mike Dedman, Mikey, thank you so much for what you did. But he helped us land Little House Lansing. It was a tough move, downsizing, but it was the right move. And you want to get the pros. You want to get the pros to help you understand and make the right purchase. Call Brock. Here's his cell phone number, 517-303-3262, 517-303-3262. Please go online to kwsellingteam.com. Tell him you heard it from Tom or Tommy, whatever you want to say, because a lot of radio people call me Tommy. That's fine. And just go there, go to our website, tommattshow.com, click on through. It's got the sweetest website you've ever seen. I mean, it's greatness. It's greatness. And I'm not just saying that because he's my sponsor. It's great. All right, back to today's show. Brock would support this so much. He's a health nut too. Opioid-free America, the 5 W's, who, what, where, and why. I hope you guys all remember that, with Dr. Matt McCord, Mike Vasquez, and Doug Geinzer. Okay, so we're going to go into some very specifics here. Dr. Matt McCord is my sort of co-host today because he's driving this thing, and he's actually helped me set this whole thing up, and I appreciate that very much. Matt, would you like to take the lead on this next segment here and get the guys rolling, please?
Yeah, so we can talk about it. You know, I think if people are listening, they're all probably a third of Americans have a personal story with opioids, and that's a ridiculous.
That's a huge number. That's like 100 million.
It's a huge number. It's ridiculous. Either family, friends, they know somebody that suffered with opioids and opioid addiction. That's ridiculous. And now we're saying that the most recent generation in America is not going to live as long as our generation, which also is a ridiculous and unacceptable stat, and that we're working against that. So Doug and Mike can share some more stats on this big problem and talk about how we're solving it with technology. Thanks.
Well, go ahead. Let's see. You wanted Mike to pick this up. Mike, you got some of the stats. We'll go to you first, and then we'll have Doug jump in there. Go ahead.
Well, I'll start with really once I challenged the team to try to prevent this, as we drilled down on the data, it was interesting. Walking through the front door of our opioid treatment center, 75% of people reported they started with a valid prescription written by their doctor, started with a knee surgery, an injury, whatever it may be.
Would you repeat that stat again, please?
You get 75%. This is supported by the NIH. So there's a report they have published that supports this number. So our data was almost right on. But they reported that 75% of the people started with a prescription written by their doctor. So your initial idea is the fact that, well, the doctors just are out there flying by the seat of their pants. They don't, they're doing something not right. And what we found then is we decided I wasn't going to accept that as the easy answer, because it's always easy to blame somebody. And when you step back, you found that different than any other diagnosis for a doctor, I do a blood test, I do a physical test, I do an x-ray, and it tells me the status of that disease or that illness. I know when to start care and I know when to stop care. Opioids are very unique. I know objectively when to start the opioid script as a physician. You have a surgery, you have an injury, you're chronic, so I know this is the starting point. Different than any other diagnosis, though, there is no tool that exists today in healthcare that helps that doctor decide when is the right time to write the last script. Because it's very subjective. You walk in today, Tom, and you say, my pain's 7, maybe I'll refill that script. But I walk in and say, my pain's 3, and let's talk about alternatives, physical therapy. So what happens is, and the thing that doesn't click is that as people become a little more dependent, those numbers get higher because I want that script refilled. And so at that point, that's what we looked for, was buried inside of every medical claim are patterns that indicate that's going on. So our AI spiders through paid claims looking for those patterns and then identifies the doctors that need that tool, that need that decision tool to discontinue. And then we have staff pharmacists who reach out to these physicians to actually help them add this tool to their practice. And once that tool's added, then that's when we saw the statistics that I mentioned in the last segment of the reduction in the unnecessary prescribing. So the key takeaway is the physician still providing effective pain management, but now has a tool to decide when should that pain management transition from opioids to alternative care, which they didn't have prior. And the thing that's kind of surprising is the healthcare industry has tried to cut back on opioid prescribing by limiting prescriptions. I'm only going to let you write a 3-day script. I'm only going to let you write in Florida, you can only do a 7-day script, on and on. But the CDC did a conference, and interestingly enough, let's say you go have a wisdom tooth pulled and your dentist writes a 3-day script for opioids. 6.2% of those people will still be using an opioid a year later. Of the people written a 7-day script, 13.5% of those people are still using an opioid a year later. So that'll give you an idea of some of the numbers that drove us. That this is bigger than something that can be managed through administrative guidelines. It needed a clinical decision tool to help them decide when to do it, but that's easier said than done.
Doug, what do you think about those stats?
So I think I'll go back to where I met Dr. McCord, and we started talking about opioid-free surgery and what the impact was that opioids had on surgical events. And the stat that shocked me, like literally shocked me, was that 10% of people coming out of surgery are coming out involuntarily addicted to opioids because they were not taught when to take that last script. So again, 1 out of 10. So that's just, it's a startling number, and it's quite discriminatory in certain areas as well. If you look at women getting a breast mastectomy after that type of surgery, we find the data shows that 20% of those women are on an opioid 90 days postoperatively. 20%. So 1 in 5 women going in for a breast mastectomy are becoming addicted to opioids. And the data, what it really shows is that there's a cliff that comes, and it's typically around day 5, that if that member is on opioids beyond 5 days post-op, they are no longer treating the physical pain, they're beginning to treat the mental pain. So we need to learn when to give that last prescription in order to turn that spigot off that we mentioned before.
Dr. Matt McCord is with us, Mike Vasquez and Doug Geinzer are with us. We're talking about opioid-free America, the 5 W's. One problem that I had with my knee replacement was my sleeping issue, okay? The first one, I didn't sleep very well. I didn't sleep a whole night for 8 weeks. However, when I got the nice ice machine, and this kind of feeds into what we're talking about with opioid-free America, everybody, when I got the nice ice machine, the very first night, the whole first week, I slept every night. I didn't sleep like 8 hours, but I was sleeping like 4 and 5. And it made such a massive difference. Now, I had other issues, as you guys know, and I did my videos and how I hurt myself, and that had nothing to do with the other part of it. But I have to say that I learned specifically with me that I had very low dose of the oxy. I didn't really like it. I mean, I wanted something that, was holistic, like the nice ice machine or something else. And that's what we're talking about here, because we need to become more educated. The stats the guys are talking about here are overwhelming. This is crazy. I mean, 20% of women with having breast surgery are getting addicted to opioids. Unbelievable. Dr. Matt McCord, Mike Vasquez, Doug Geinzer. I can't say how much I appreciate these guys. I'm so grateful. Opioid-free America, the 5 W's with 3 pros. This is the Tom Matt Show.
This segment of the Tom Matt Show is brought to you in part by the Source of Light and Power by band leader Ark of All and broadcaster Mitch Anderson. Hear the sound that is endorsed by Odyssey headphones, linear tube audio, RME converters, and Peluso microphones at sourceoflightandpower.bandcamp.com.
Welcome to the Tom Matt Show.
Welcome back, everybody. Welcome back to this week's episode of the Tom Matt Show. Love this episode so much. You're going to want to bookmark this thing. We might win another MAB, Michigan Association Broadcast Excellence Award for this one, because this show is rocking and rolling. Opioid-free America, the 5 W's with Dr. Matt McCord, my personal anesthesiologist. I guess I can say that. He was my anesthesiologist. Mike Vasquez and Doug Geinzer are with us, 3 experts in this field of the opioid-free America. These guys are awesome. Want to remind you about our website, tommattshow.com. If you miss any portion of any of the episodes, go there. We got everything's there. You want to go to Spotify, you want to go to Apple, you want to do all that, you want to go to YouTube, you want to go to TikTok, Facebook, all of it. It's all one-stop shopping over there. And I'm going to talk to Dr. McCord about putting his banner on the bottom of our homepage so you guys can click on through, because I want this problem to be solved. I want to be part of this whole solution, because if we're not part of, as I say all the time, you guys, the soul, S-O-U-L, solution, you better get a clue, okay? Because this is a huge problem. I want to go back to Dr. Matt McCord here. He's got some specifics. Well, Matt, start the whole process here. How in the hell did we get here?
Yeah, so this America's opioid crisis really is about 30 years in the making. Really, my entire career. It began with really making opioid use, really promoting opioid use and chronic opioid use was safe and a modern way to treat pain. And we had pain as a fifth vital sign. It was really a great marketing ploy by a number that's been well cataloged, by the way, by a number of drug companies. And Big Pharma owns both our media and our medical science. 89% of all scientific journal articles are sponsored by Big Pharma as well. But they also sponsor all media. So when you watch a news channel, you'll notice that they're all drug company advertisements during those broadcasts. But the narrative that Big Pharma likes to promote is our opioid crisis is really the fentanyl problem. And coming across the border and coming from China, it's fentanyl that's the problem. That's the opioid crisis. Fentanyl is actually the sequel to the opioid crisis. The prequel, the origin of the problem is actually our rampant overprescribing of opioids in America compared to the rest of the world. The rest of the world treats opioids much more respectfully. They do not use opioids nearly as often as we do, and there's some great studies about that. But I'd like both Mike and Doug and Mike to talk about more stats regarding this and how Big Pharma is kind of influencing this narrative as we go. Thank you.
Go ahead, Doug.
Yeah, so I think in an earlier segment I talked about I'm a perpetual entrepreneur. I started my career in the media space. So I built and sold a couple of successful media companies out there. And I spent a lot of time looking at the P&Ls of various media companies, both print, broadcast, you name it. And what you'll find is about 50 to 75% of their profit margins typically come from the pharmaceutical group. So they're going to take some of their editorial directive from there, even though there's supposed to be separation between church and state, marketing and editorial. I could say that simply is not true. And so today, when you're reading the media, everybody's saying it's a fentanyl issue, it's a fentanyl issue, it's a fentanyl issue. As Mike Vasquez has stated, 75% of people that have an opioid issue, it started from, or an addiction issue, it started from a legally prescribed opioid. And where this goes south is when we either don't titrate a member off of opioids, or imagine this is what happens all too common. A member gets hurt on the job, a member presents and gets terminated from their employment, and now they no longer have health insurance. Without health insurance, they no longer have access to a legally prescribed opioid. They're going through those withdrawal symptoms. Where do they go? They go to the streets. And out on the streets is where they find a product that is now laced with fentanyl. But it's not fentanyl that caused the issue. It's the legally prescribed opioid. And our goal and our objective is to get ahead of this and eliminate the unnecessary prescribing of opioids in the first place.
Mike?
Yeah, even I'll drill down on one of those interesting statistics, because not that fentanyl, this isn't to emphasize the impact of fentanyl, because it has been, but a lot of those impacts have been through illicit use, because a lot of people, even the physicians and the hospitals I talk to every day, don't realize that there are hundreds of opioids out there. And as an opioid is metabolized through your body after you've taken it, it turns into different elements. So when you do a pathology test, you're looking for those elements. So during an autopsy, I'm looking for those elements. And then on the death certificate, I put opioid overdose. Interestingly enough, fentanyl has its own unique metabolites. So when the autopsy is done, it shows that just those metabolites exist. So the death certificate says fentanyl, but it never says the fact that I was an opioid addict and progressed to fentanyl. So the fentanyl data in some cases is a bit overstated because of that fact of just the reporting, because then when they scan the death reports in, the CDC gathers all that data and then reports on it. So that'll give you an idea kind of how we approach it from the aspect of you've got to stop it at the opioid stage, because then you won't progress to that period. And why do you progress? You progress because of the fact that the industry, there's the most sophisticated systems you can imagine out there. I had a client the other day tell me, I have the most sophisticated pharmacy system in the world. I have the most sophisticated insurance claim adjudication company. I can't imagine you doing anything they don't do. And I said, I agree. They do the best job there is of actually managing and identifying and reporting utilization. I'm utilizing an opioid, and I'm doctor shopping, I'm pharmacy shopping, I'm getting a prescription filled early. The difference is what we look at is withdrawal. And withdrawal happens 5 months before the first addiction indicator. And what is withdrawal? Withdrawal is the body screaming out that says, you're denying me an opioid, and I'm going to make you sick until you give it to me. And those are made up of hundreds and hundreds of illnesses. And that's actually the algorithm that we look for, the patterns we look for. Because think about it. You're a great example, Tom. You take your opioid, and now all of a sudden you're feeling better, so you transition a little, but then 2 days later you're not sleeping, so you think, maybe I'll just take another opioid. And what happens is, unknowingly, because you'll go into withdrawal symptoms 4 to 8 hours after the opioid prescription, if you don't take the script, you're unknowingly and unintentionally putting yourself into withdrawal, creating those exact same illnesses, those exact same patterns that predicate becoming addicted. So that's how it all links together. And so what's unique about what we do is we find patterns of withdrawal. Interestingly enough, because those will start 5 months prior to the first addiction indicator, it creates that window for us to intervene and turn this into a pain management protocol as opposed to a pathway to dependency or addiction. So that'll give you a little data, I think, at a high level.
Dr. McCord, do you want to follow up on that? We got a couple of minutes before we go to break here, and I'll give you the signal when we got to break. But why don't you follow up on what the guys just talked about?
Yeah, so I think it's important, too, to talk about how this is impacting communities and state budgets, because really this is a common pathway. Doug, you could speak to how these folks become Medicaid recipients.
Yeah, so if you think about it, the progression of somebody that's building dependency on opioids. So they're working for a company, they're working for a union, they're out in the field, and their commercial insurance or their trust, the health trust, is covering their prescriptions. They get hurt, they get injured, they get terminated. Where do they go? They land on the streets, they show up in an ER, and the first job that the hospital is there to do is, how can we recover some of the fees that we're going to spend on this person, so they then enroll them in Medicaid. Once they enroll them in Medicaid, they get into treatment programs, and the data shows that the average person will go to an addiction treatment center 5.4 times before they get clean, if they're able to survive that long. And so that financial burden now lives in the Medicaid system itself, and it now becomes a tax burden for every single American, typically paid by employers, then paid by the rest of the American public. And now that Medicaid budget that continues to expand is also starting to take away from the education budgets and the public safety budgets of the average state, because the average state, if you look at the state budget, typically the two that are fighting for the top line are both Medicaid and education. So it's a big burden on the United States in terms of the Medicaid budget.
I'm going to carry this through, everybody, because we're going to go to break here. And I have so many questions about when you say the cost, I'm like, well, how much is this costing when you have almost 5 visits to rehab? How much does rehab cost for one visit? And now you got multiplied by 5, and we're bearing the cost of that, or part of the cost of that. It seems completely absurd to me. And it's just like, what a scam. I mean, it's just, it's a scam. I don't even want to go down the road. Dr. Matt McCord's here. I'm getting ticked off. I don't want to get ticked off on my radio program, but you know what? These type of hot button topics are like, Everything money. Dr. Matt McCord, Mike Vasquez, Doug Geinzer's here. Opioid-free America. Let's get things fixed, everybody. The 5 W's: who, what, where, and why. We got one more segment to go with these fine guys, and we're going to crush it. You're listening to The Tom Matt Show.
Thank you again to Brock Fletcher, real estate agent at the selling team with Keller Williams Realty. For more information on services provided by Brock, please call his personal cell phone at 517-303-3262 or by emailing Brock at kwsellingteam.com. This is The Tom Matt Show.
Welcome to The Tom Matt Show.
Welcome back, everybody. I am having such a good time with this radio program today. Doing radio is just such a joy because I get to talk to some very, very, very smart people, and it's a blast. I get to learn so much, learning a lot about a big problem. But you know what? Until you define the problem, until you acknowledge the problem, I know this because when I went through AA, when you have to acknowledge the problem before you can fix the dang problem. If you keep running around, if you're not accountable for your own problem, you're never going to fix the dang problem. So that's all I'm going to leave it. Again, TomMattShow.com. If you miss any portion of the show, you want to get back to this one. Opioid-free America. Dr. Matt McCord, Mike Vasquez, and Doug Geinzer. Okay, Doc, let's go back to you. I want to wrap this thing and give you guys plenty of time for your takeaway and close. I know you got more you want to talk about with a call to action. Please, let's continue this conversation. Go ahead.
Yeah. So the reason this problem hasn't been solved up till now is that the industry benefits from opioid prescriptions. More opioid prescriptions increases revenue for those for hospitals and health systems. It increases revenue for carriers in some. If you look at medical loss ratios, we could explain that. But Mike Vasquez can explain what we're seeing in the data that is showing those costs.
Thanks, Matt. Now, as I mentioned in the last segment, that our algorithm can actually identify these medical patterns up to 5 months before the first real addiction indicators show up, and the systems that exist today are focused around those addiction indicators. But what's the buried number in there is the average patient in the U.S. who's prescribed an opioid can incur up to $15,000 during that 5-month window. Now that $15,000 is now paid by their health plan, the Medicaid, whoever the insurer is, and if those could have been identified or discontinued when the opioid had run its course, none of those expenses would have been incurred. Great example, Tom, is use your analogy. You couldn't sleep at night, but in a lot of cases, patients go then to see a doctor, and they end up having the doctor encounter. They get on Ambien, and now they're diagnosed with a sleep problem. Because doctors don't have systems to tell them that sleep problem is actually related to how you're taking the opioid, not the actual opioid, because that's a drug-to-drug interaction, and physicians have all kinds of tools for that. But because you become inconsistent, I talked about my hip this morning feels fine, so I'm going to skip my script. I'm busy through lunch, I skip it again, and I talked before, I start to see those minor withdrawal symptoms within 48 hours. So by the time I get home from work tonight, I'm chasing the pain, and a little bit of that withdrawal that I feel, that anxiety, goes away when I take that opioid, and then that starts the cycle. And so that's really where we talk about the fact that then turns into both a medical issue as well as now it reflects directly on cost. And that's where it costs both the individual, the health plan, and society. Because you have to remember, we all think about addiction, right away we go right to death numbers, overdose and death numbers. But you don't realize during this early 5-month period, that's where families become disruptive. That's where finances become disruptive. That's where careers are disruptive. And that's really the underlying thread that tears the economy apart, tears communities apart, and obviously tears families apart. And that's where the benefit, I think, of prevention is the fact that being able to intervene at that early stage eliminates those sort of things that really disrupt the entire core of the family unit. And that's where that never gets recognized, never gets measured, because until it progresses to death and overdose, it's not a statistic because it's not measurable. But that's what we saw every day as people told us their story, and that's what motivated us. So if we can't prevent this, by preventing it, we can eliminate that piece that really people aren't even focused on or aware of. So that's really a big driving piece for what we're doing.
let me ask you guys a question here. Like, if going through my stuff, using myself as an example, could I have gone to the doc and maybe requested something and said, hey, I want this? Because when I went through the first knee, I couldn't sleep, I really thought it was caused by the drugs. I mean, I had no idea what the hell was going on. I was so frustrated, and it wasn't the drugs at all. It was just me. It was me not doing my drugs correctly. And as you were saying, I kept chasing pain. I was trying to be a doctor myself, and I'm not a freaking doctor. And so I learned the hard way that, like you say, and I never heard the term chasing pain before, getting behind on your pain. Never heard that term before. And let me tell you guys, if you have surgery or even have like a root canal or something like we're talking about, you may be on that edge. What do you think, Doc?
Yeah. I was a clinical advisor for Michigan Open, the opioid prescribing and engagement network. And we taught other clinicians on how to manage pain acutely as part of that program that was co-sponsored, I believe, by Blue Cross Blue Shield of Michigan and through the University of Michigan and Chad Brummett's lab over there. Hey, Chad. So if you do a regularly scheduled anti-inflammatory progression post-operatively, that will help you stay ahead of pain. It will decrease swelling and inflammation. So that's what we do, and we instruct folks on.
And that's another thing. Let me add this to everybody, and we'll get Doug in here. But a lot of the pain that I was suffering from was inflammation. It was the tightness and the stiffness and the soreness. And then when I hurt my quad, that was just pain. I mean, it was just, I had to deal with it. Okay. So Doug, you want to jump in and add some more of your stats to this stuff and try to do more of this call to action for our show. We got about 5 minutes to go here. You guys can start wrapping into your takeaways as well. It's been a great show, and I appreciate you guys very much. Go ahead, Doug. Add in whatever you'd like to add in.
Yeah, I think what we're looking for at Opioid Free America is folks that want to roll up their sleeves, get involved, get engaged, and help solve this problem. It's going to take a village to do it. It's not going to take just a few. What we're looking for, there's benefit advisors that advise these health plans. There's the elected officials that are out there, and this opioid crisis is not only good policy, it's good politics. As Matt said early on, it's a bipartisan issue. And then also those that are managing at the state, local, city, municipality governments, because many times in those communities, those folks are the larger employer in the area. If you think of the states and their employment, and you know what? They have opioid issues just like the rest of us. The unique part that we didn't talk about today, Matt, was the ability to utilize the opioid settlement dollars to help solve this crisis. So there are about $60 billion of opioid settlement dollars that have been put out on the streets. Every state has its fair share of the opioid settlement dollars. Those dollars typically flow into the state. The state keeps the first 50%. The next 50% goes down to the county level. They need to invest those dollars. Those dollars should be invested in the prevention of opioid addiction. And I say that again, the prevention of opioid addiction, not the prevention of just death. If we turn off the spigot at the very top, we're going to be able to resolve that and not have to manage the crisis, but solve the problem where it starts in the first place.
How do you make sure that money is allocated correctly, though? Because you start giving $1 billion to a state, and 50% goes to the state, and 50% goes to the county, and all of a sudden, 10% is going to the roads and 15% is going to schools. And, oh, wait, we got a hole in the budget over here because we got COVID money that we didn't count. How do you guys track that?
So the settlement dollars do tell them to spend at least 15% in the form of prevention. Our biggest pushback today is the definition of prevention. And again, we want to prevent addiction, not just prevent death. I'll give you a statistic or some inside information. The tobacco settlement dollars of the 1990s, many of us remember those. There was about $240 billion that was put out on the streets. When they look back in hindsight, only 2.74% went towards true prevention. The rest just filled coffers and various budgets. So we need to make sure that we invest the proper amount in true prevention, and that is prevention of addiction. And that means knowing when to write that last prescription.
All right. So the takeaway, because we got about 2.5 minutes to go here, Dr. McCord, you want to wrap this thing up, and you guys each get a few minutes to take a takeaway, 30 or 40 seconds. Go right ahead. Thank you guys so much for being on the radio program, the podcast today. I appreciate you all very much. I want to give you all at least a minute or so to do your close. So, Matt, you want to take the first one?
Yeah, thanks, Tom. Thanks so much for being my patient.
My pleasure. And, thanks for being my doc.
Yeah. And it was a true honor.
I wish you were my doc the second time.
Yeah.
Sorry.
Yeah, it was a true honor, as always, for me. It's a great job. But I think in all these counties and communities, all these legislators that want to do the right thing with opioid settlement funds, I think it's important for them to focus on prevention and getting ahead of this. Almost all efforts, almost all resources are spent on a very downstream solving of the problem, and that is they're building addiction centers. They're treating the problem way downstream, which is so much more expensive than if they got in front of this and prevented the problem from occurring in the first place, and prevented opioid addiction before families, people lose their jobs, lose their families, lose everything but maybe their lives, and then also lose their lives. But we got to get in front of that. And that's where technology like this can really be helpful to help improve America's health and livelihood and heal communities. And that's what we're all about at Opioid Free America. Thank you.
Doug, give us 30 seconds.
Yeah, just please get involved. Go to opioidfreeamerica.org. Again, opioidfreeamerica.org. It's a nonprofit physician and veteran-led organization. Get involved. Sign up for the form. We will reach out to you. We need more people to join our army to stop this crisis.
Mike, 30 seconds, please.
I think the easiest way is I actually just wrote a book about this entire topic today. And if any of your listeners are interested, get an email to Matt, and I'll get a free digital copy of the book out to all your viewers or listeners. So that'll be I think, an opportunity to at least see if this topic interests you, you're involved in. That's one way you can get a lot more detail.
I want to thank my guests for being with us today. Dr. Matt McCord, Mike Vasquez, Doug Geinzer, Opioid Free America, the 5 W's. Remember, everybody, always remember, before you can share love with others, you must love yourself first. You've been listening to The Tom Matt Show. Thank you to Mitch Anderson and Vanessa for what they do. Tom Matt Show is a production of Boomers Rock Media. We want to bring your story to life. We are out.
The Tom Matt Show is produced by Mitch Anderson of Black Circle Studios. Original music from the Source of Light and Power by the Ark of All.